Joining us in the studio for more on the subject is Jane Pan, Executive Director of the Hepatitis B Initiative of Washington, D.C. Ms. Pan, welcome to the show.
Thank you very much.
First of all, let me have your reaction to this release that WHO, the report that WHO released. What is your reaction to this?
We are very, very excited about that. And our Health and Human Services has the same strategic plan for eliminating hepatitis in 2030. And HBIDC is working along with the same strategic plan to eliminate hepatitis in 2030.
Very interesting. In the report, the WHO expert says something very critical. He said that a lot of time people do not know the hepatitis status. Why is that? Is it something that you find as you go in the community, and is there a reason for that?
Absolutely, absolutely. Most of the people who has the hepatitis virus, they don't know it. And the reason is, that's why they call it a silent killer, because there's no symptoms. There's no symptoms that if you have viral hepatitis.
Until it gets to that stage where it's critical.
Until it gets to the stage that it's too late. And it's really not necessary, because there is a cure for hepatitis C, and there's a treatment for hepatitis B. And there's also a prevention with the hepatitis B vaccines.
Now, your organization works in the community to serve underserved communities. What type of hepatitis are you seeing more frequently, given that there is more than one type?
Sure. So we screen for hepatitis B and hepatitis C. So in some communities, hepatitis B is very high prevalent, and in some community, hepatitis C is very high prevalent. So we see both of hepatitis B and C in our communities.
So after the screening, because screening is definitely something that you do very much, having followed your work, after you screen, what next?
So after we screen, for those who tested positive, we try to link them to care. You know, whether they have insurance or not insurance, we tried our best to link each person to appropriate doctor to care.
And do you find that people really understand the message, the type of messaging that you are sharing with them when it comes to this condition?
We find that we have to do a lot of education. Mm-hmm. And education is the key to tell the public, you know, what is at stake. You know, liver cancer caused by viral hepatitis. And
what is the message really when you work with the community? What do you tell them?
We tell them hepatitis causes liver cancer, and it's not necessary to suffer. And the key is get tested. Get tested, find out your status, your hepatitis status, and there is a cure and there's treatment.
Okay. So it's very important to know your status. Once you know your status, everything starts there. There is hope. It's just like when we think about it, HIV/AIDS, really, you have to know your status.
Right.
But why do you think that we don't hear so much about the need for screening when it comes to hepatitis? Because we hear a lot about HIV/AIDS. You have to know your status, you need to screen. But hepatitis doesn't seem to get that much coverage, at least from my understanding.
Absolutely, you're absolutely right. That's why a segment like this is very, very helpful, that we need to tell everyone about viral hepatitis, how important it is to find out the status.
So who is most at risk of catching hepatitis, and how can they protect themselves?
So the risk factors is if you come from countries with a high prevalent rate, and if you inject drugs, if you're born in the year of 1945 and 1965, and you should all get tested.
Okay. And how can they prevent themselves besides vaccine?
So, and lifestyle changes.
Okay.
And they can prevent, and then find out the status, and get with hepatitis B, there's a vaccine, and that's how they can prevent that.
That's fantastic. Ms. Jane Pan, thank you so much for joining us today.
Well, thank you so much for having me.
Great.
Thank you.
And that was Jane Pan. She's Executive Director of the Hepatitis B Initiative in Washington, D.C.